Hello, everyone, and welcome to today's webinar on Learn More About Your Labs. My name is Jennifer, and I'm part of the LiveWELL team, and I'm happy to bring this topic to you. You will be able to receive a personal incentive reward instructions at the end of this presentation, so make sure you stay tuned for that. Let's get started on learning more about your labs. What we're going to go through today is why it's important to know what your labs mean, what numbers you should pay close attention to, which risk factors can be changed and which cannot, how often your lab should be taken, and when to take further action for your labs. Why is it important to know your lab values? Well, if you know what your numbers are, it can avoid costly health problems, increase your value of life. It can allow you to ask questions that you might be curious about when it comes to your health. So you can have really great conversations with your medical providers about how to improve your health or keep you nice and healthy. Knowing your labs help you manage your risk factors, chronic conditions. So if you know ahead of time what you need to look out for and where your optimal number should be, you can make great decisions for your health. Which numbers should you track? We really recommend taking a look at your blood pressure, your cholesterol panel, which includes your total cholesterol, your LDL, your HDL, and your triglycerides, and then also your glucose or your A1C, which we'll talk about each of these. These numbers are important to identify your risk for heart attack, stroke, diabetes, and cancer. What's great is our Atrium on-site healthcare locations can do these labs for free. So you don't have to go somewhere outside if you want to know what your numbers are. We can get those done for you right on site at one of our on-site care clinics. Most of these labs are included in your annual physical. When you see your doctor, he will determine if the labs are appropriate to be done annually or if you can do them every other year. But it's important to check in with that doctor annually. Let's talk about blood pressure. Blood pressure is the force of your blood moving against the walls of your arteries, and it is expressed in two numbers. You have your top number, which is called the diastolic, which is the pressure of when the heart contracts. And then you have your diastolic, which is the bottom number. And this is the pressure measured when the heart relaxes between beats. If your blood pressure runs high over time, it can create problems within the arteries, your kidneys, your eyes, and increase your risk of heart attack and stroke. Here are the numbers for where your blood pressure should be. These were updated actually just recently last year, so a little bit of change here. We really are looking for your blood pressure to be less have a 120/80 or between 129 and less than 80, you're considered to have slightly elevated blood pressure. And you can see from the chart how the numbers go up. These numbers are conservative because American Heart Association has decided that the lower we can keep our blood pressure, the healthier and the lower risk we have for heart attack and stroke. Now let's talk about cholesterol. Cholesterol is a fat-like substance in your blood. Too much cholesterol can clog your arteries and increase your risk for heart attack and stroke. Cholesterol is an important building block of hormones. It's in every cell of our body, and our liver uses it to make bile, which is essential to digestion of fats and vitamins. So some cholesterol in the body can be good for you. We want to make sure that we do not have too much and that we have the right type of cholesterol. There are two different types that we look at specifically. Then we have the triglycerides. The first type of cholesterol we'll talk about is our HDL. This one you could consider your healthy cholesterol or your good cholesterol. The second one is your LDL. This is considered your lousy or bad cholesterol. So the HDL we want to be high and the LDL number we want to be low. Another number that doctors will look at will be your triglycerides. That's the fat in the blood. this number is directly related to the what the fat of the animal products and the fat that you consume. Here are the values for your cholesterol. If you're looking for the optimal numbers, your total cholesterol should be less than 200. Your LDL should be less than 130, but really the lower the better. Your HDL should be 50 or higher, and your triglycerides should be less than 200. Now let's talk about glucose and A1C. The glucose levels in the blood are higher if there's not enough insulin or when the body does not respond properly to the insulin. High blood glucose means more glucose is attached to the hemoglobin and the red blood cells. Why does this matter? If you are not able to monitor to regulate your glucose, you'd be at risk for diabetes. The two tests that they're going to look at that your doctor will pull will be your fasting glucose as well as your A1C. The A1C is considered a better indicator because it's a 3-month report card of what your glucose numbers have been over that time. Poor control of blood sugars over time damages your heart, your blood vessels, your kidneys, your nerves, and your eyes. Here are the values for both of these numbers that we would consider to be within range. For the glucose reading for fasting, we want it to be 80 to 100. After 2 to 3 hours after eating, we would like that number to be under 140. For fasting glucose, pre-diabetic is considered 101 to 125, and diabetic would be considered 126 or higher. The A1C test results you can see on the side. Normal is below 5.7, pre-diabetic would be 5.7 to 6.4, and diabetes would be considered 6.5% or higher. What other numbers should you track? It's a good idea to know your body weight, your waist circumference, and your body mass index or your BMI. We have lots of resources on our website to help you measure these 3 pieces and know what's considered within a healthy range. The waist circumference is a very easy measurement. You just use a tape measure and measure around the abdominal area just above your belly button. Men, their waist should be 40 inches or below. For women, it should be less than 35. Those two are what would be considered healthy. If your waist circumference is higher than those, you are at increased risk for chronic conditions. The body mass index is another height and weight table that helps to classify underweight, normal, overweight, and obese. The BMI is used very broadly, but keep in mind, this test is not, it's just your height and weight, it's not female, male specific, and doesn't take into account extra muscle mass. The waist circumference is going to be a better indicator of risk. When we talk about risk factors, there are risk factors that you cannot control, and there are risk factors that you can control. The risk factors that you cannot change are your age, your gender, your ethnic background, and your family history. But the risk factors you can control, smoking, high cholesterol, high blood pressure, diabetes, being inactive, your weight, unhealthy eating, depression, sleep habits, and stress factors, those are all things that are within your control. It's important to know your risk factors. If you know that you have many risk factors under the cannot control bucket, You want to do the best you can to control the ones that you can so that you decrease your overall risk of contracting a chronic condition. Steps to reducing your risk. Identify which labs may be abnormal. Go and see your doctor. Get your tests done. Talk to your doctor about where your results are. Assess what may be causing abnormal labs. Do you need more exercise? Do you need to change your eating habits? Are there other lifestyle habits that need to be changed? If it's preventable or borderline, assess which risk factors you can change. Look at those two buckets again and decide, do I need to quit smoking? Do I need to increase my exercise? Do I need to increase my fruits and vegetables? What kind of things do you need to do to increase your health? And then come up with a plan. You can speak with one of our health coaches for a preventative action plan. They can help you with meeting and setting goals. If you need to go on medication, talk to your doctor. Medication can be helpful, but sometimes just a lifestyle change can be enough. Sometimes just a 5 to 10% weight loss can help to change your numbers dramatically. You can have positive results with just 30 minutes of brisk walking 5 days a week. It doesn't have to be anything super strenuous, just to start those numbers to change. Eat a healthy diet that's high in fruits and vegetables, whole grains, and low and lean proteins. If you're a smoker, quit smoking. We have tobacco cessation classes offered through Atrium. You can do this through the on-site health clinic, or we have other resources located on the LiveWELL webpage. As discussed, consider medication. Talk to your doctor and see if medication is the right thing for you. Sometimes just a small dose can help while you're going through those lifestyle changes. Sleep is very important. Make sure you get 7 to 9 hours of uninterrupted sleep and manage your stress as much as possible. When eating heart-healthy foods, you want to make sure that you have a colorful variety of foods, vegetables, and fruits. Eating fish twice a week can help. Choose lean red meats. Fiber-rich whole grain foods, nuts and seeds, and a little bit of healthy fat can also be helpful. You want to make sure that you limit sweetened beverages, sweets of all kinds, deep fried foods, and baked goods, and processed and cured meats. This is just a great graphic to show what foods to eat more of and what to limit, and then what not to try not to consume at all. Moderation is the key. Nice, good, balanced diet. If you're looking to put a healthy plate together, here's a great example of what that would look like. As you can see, most of the plate is made of vegetables and fruits, and then you have an area for whole grains and then your healthy proteins. There are many resources to help you get started on making lifestyle changes. We do have medical nutrition therapy, health coaching, smoking cessation. If you have questions about your medications, you can contact Carolina Care, the 101 RX, or visit our LiveWELL website for additional resources on weight loss and support. Be sure to get your labs done once a year at your annual exam. If your labs are abnormal, your doctor may want to get them checked a couple times in the year. Try fasting for more accurate test results. If your doctor recommends seeing a specialist for your numbers, be open to that. This can be very valuable. And keep your family or close loved ones involved and track your progress. If your numbers are high, what can you do? consult your doctor for sure. If you need to find a doctor, if you don't have a regular physician, you can visit the medcost.com Atrium Health website, or you can call this 1-800 number. Your annual physical under the LiveWELL plans and most insurances will be covered at 100%, and that includes your basic wellness labs. Many medications that your doctor may prescribe are going to be of very low cost or could be free depending on what he prescribes. So talk to your doctor about that. If you're going on medication for the first time, or if they're changing your dosage and you're unsure, you can definitely talk to Carolina Care. And a trained pharmacist will help answer your questions. Make a goal. Identify one small thing that you can accomplish in the next 1 to 2 weeks. We recommend making a SMART goal, which would be specific, measurable, attainable, relevant, and time-bound. So an example would be to cut sugar from soda, to cut regular soda from 32 ounces to 12 per day, plus adding 20 ounces of water for 7 days. That would be a SMART goal rather than just I'm going to have less sugar. If you're going to make a SMART goal for exercising more, I'm going to walk 15 minutes a day at lunch 4 days in the next week. If you're not sure how to make a goal or not sure if you can make a goal and then accomplish that goal, please talk to one of our health coaches. They can help you make a goal and help make sure that you achieve that goal and give you great motivation and education along the way. Thank you for attending our webinar. You can go to get your incentive. You can log into your Total Health portal, then go to the Personal Incentive tab, and then select the Educational Webinars. The name of this webinar is Learn About Your Labs. I am the instructor, Jennifer Collings. The webinar code is JC0204, and then make sure you write in your SMART goal. Once you've submitted this, you should see the reward show achieved within 24 hours. Don't forget to do your personal health survey if you haven't done that already. Thank you so much for attending our webinar today.